Hello everyone and welcome to Chapter 4, the respiratory system. Chapter 4 is I think it's easy. Maybe it's just because I've worked in medicine so long and as a paramedic we did a lot with the respiratory system. So the parts and the terminology is pretty familiar to me. But I think it's pretty straightforward except for some of the weird pronunciations. And later on in this chapter it discusses some of the disease processes, which may be a little in-depth for a medical terminology class, a med terms class, but it's always good to know some of the signs and symptoms of lung cancer and some of the other things that are out there that are pretty nasty. So let's go through this just a little bit and look at some of these things. I won't take up too much of your time. Like I said, I think you probably know most of this already. So upper respiratory tract, nose and pharynx. Basically, what's in your mouth and... Oh, where's my face? Let me put my face back up here. To about right here, right? Everything up here. This is the upper respiratory tract. Nose and pharynx. There is a weirdness about the upper respiratory tract. When we start talking about bronchitis and other infections, we often refer to them as URIs, upper respiratory tract infections, when they're really not. Really lower respiratory tract, it's just a misnomer. One of those weird things, something for you to know, put in the back of your head somewhere and never have to remember again. But when someone tells you have bronchitis, it's an upper respiratory infection, you can go, well, it's not really. Anyway. The upper respiratory tract also includes the larynx and the trachea, and you can see that there. And then it breaks off down to the lower respiratory tract, somewhere, I don't know, right in here-ish, somewhere is where it breaks off and becomes the lower respiratory tract. And it depends on who you ask, all right? And there you have the bronchi and then bronchioles, which eventually lead to the alveoli. And I think you guys probably know all that from other places. You can probably hear four-wheelers riding outside my house right now, so sorry about that. You got two lungs, most of you probably do. The left lung has 2 lobes, the right lung has 3. Why? It's the way it is. Don't blame me, I don't know. There's more room on the right side because the heart's not there. The heart leans a little to the left, not a lot, but a little to the left, so maybe that's the reason, I don't know. Oops, we went the wrong way, didn't we here? Oh no, we're just going in the lungs, all right. And then in the lungs we have the alveoli, that's where the ventilation or respiration actually takes place. The diaphragm, that's the muscle that goes up and down and makes negative pressure in our chest and makes us breathe. What does the respiratory system do? Basically, it does gas exchange. Gets oxygen in, CO2 out. That's the main purpose of the respiratory system. It does do occasionally some other things. It will help you blow off some toxins in your bloodstream. I know none of you have ever consumed alcohol or been around people who've consumed large amounts of alcohol, but if you notice afterwards, when they got a big hangover, their breath may smell real fruity and they're breathing a little harder, and their body's actually off-gassing some of those byproducts of the alcohol. It's why breathalyzers work. Your body's getting rid of alcohol through your lungs, and you can test how much is in the body. So it does a few other things, but mostly oxygen in, carbon dioxide out. The questions, I think you get those are pretty straightforward. So let's move on. The terms here, naso or rhino refers to the nose. You'll hear rhino or rhinoplasty, right? That's the typical term for a nose job. We don't hear called a nasoplasty, but they both refer to the nose. Tonsil, you guys get that. Adenoids is some tissue there in the top back of your throat, and the pharynx or the pharyngeal cavity. You'll hear both of those. So no big deal there. One term here on this page, number 7, pneumo or pneumon. Right, that refers to the lungs and the chest cavity. So there's a couple places where it pops up. It refers to air, lungs, chest cavity. You could have like a pneumothorax or pneumocystectomy or all these other kind of crazy things. So just be aware of the pronunciation there. Cruising on through here, I don't think there's too much in here. I'm going to pause the video and get down to the next important step. So the book does go into a couple of diseases. One of them it talks about is sleep apnea here. This is basically when you stop breathing for whatever reason at night. Sometimes, most often, it talks about the causes here. It's usually associated with obesity, the tongue, and there's less room in the throat when you have extra adipose or fat tissue there. And the tissues kind of get swollen up as they're just full of fat. I don't mean to make it ugly, but they just are. And then they fall back into the back of your throat when you sleep. It's obstructive sleep apnea. Then stuff gets in the way. People who snore are more likely to have sleep apnea because they already have stuff in the way. This is a serious problem. People die of sleep apnea. And it affects other things in their life. They don't sleep well, so their blood pressure goes up. They get into car accidents because they're so tired. Sleep apnea is a big thing. Obstructive sleep apnea is bad. Central sleep apnea, the idea just even scares me. So central sleep apnea is when your brain just doesn't send the right signals to the rest of your body and you don't breathe. That's scary. This often happens in newborns or premature infants. Might be one of the reasons of SIDS. And it can happen just to anybody at any time. If you have somebody that has some kind of nerve conduction disorder or MS or all these other things that affect your nervous system, it can happen, and you can have central sleep apnea, and sometimes you get through it. Sometimes it can be fatal. It's pretty scary. So our bodies, the fact that they work is amazing and a miracle in itself sometimes. So how to get rid of obstructive sleep apnea? There's a bunch of ways to do it. Weight loss, the number one way. You can have a tonsillectomy and an adenoidectomy. I always screw that one up, adenoidectomy. Don't laugh, they call this a TNA for tonsil and adenoidectomy. I know that abbreviation is used for other things sometimes, but it is what it is. You can also have a uvulopathopharyngeoplasty. Basically what they do is they go in your uvula, the little dangly bit hanging down in the back of your throat, your uvula. They can cut it off, or they can put in like little plastic, I don't know, they look like little plastic strips, and just, let me put my picture up. They take it and they just lift everything up back there and make it not as floppy, and then it doesn't flop down when you lay down and go to sleep. It's kind of interesting. All right, you can do CPAP, you can use dental appliances. There's a bunch of ways to do this, but if you know people have sleep apnea, this is a serious thing, and they do need to get treated for it.